Good afternoon, everyone. Good morning if you're joining us from the West Coast or otherwise. I want to thank you all for joining us on our webinar today of Procuring Health, the Power of Eco-Friendly Purchasing and Healthy Food Purchasing Policy Solutions. We will wait a couple minutes before, as more people join us, but I would like to introduce myself. I'm Cassandra Allen, the Program Officer at CityHealth. And today I'm excited to be joined by our partners, Center for Environmental Health, also known as CEH, and Center for Science in the Public Interest, CSPI for short. We are excited to join and jump into our policies, but I want to give a quick rundown of today's agenda before we jump in. We'll be starting by sharing a little bit about CityHealth. Then we'll jump into our eco-friendly purchasing policy from CEH, followed by healthy food purchasing from Center for Science in the Public Interest. At the end of today's session, we will have an audience Q&A, so I encourage you to put any questions that come to mind in the Q&A function of Zoom this afternoon, and we will wrap up with some great resources from CityHealth. To get us started and get some more people in the room before we jump in, I want to invite you all to join us on slido.com. And we're going to start with an easy one. Please tell us where you're joining in from. What city do you live in? We'd love to hear and see who we have represented today. And once again, to join, please scan that QR code or visit slido.com and type in 1217618. All right, I'm seeing DC, New York, Austin. I myself am joining from sunny Orlando, Florida. Austin's getting bigger. All right, DC. It looks like we have a competition between Austin and DC today. Portland, Honolulu. Ooh, welcome, welcome. We are so excited to have you join us, no matter what part of the city and the states you're from. Durham, all right, North Carolina. Wonderful, wonderful. These are all amazing CityHealth cities. We're so excited to have you join us this afternoon. San Francisco Bay Area. Fantastic. Amazing. Well, in the spirit of today's webinar, I want to ask, what's the signature food from your city? Please share with us. What's that signature food from Austin, Durham, DC? Okay, we got tacos. Where else? What else? Ooh, lobster rolls, pizza. Oh, we're getting specific here. Breakfast tacos, a half smoke. We got straight from DC. I see that. Poke. Wonderful. Crab cakes, bagels. These are some great options. I don't know how well these options would do with healthy food purchasing, but these are some great and delicious options for sure. And then just to make sure and see where we're at, if your city hall could swap one product category for a safer version, which product category would you pick first? Cleaners, carpets, or furniture? All right, cleaners coming in hot. No one wants any ergonomic chairs, anything like that. Oh, cleaners, furniture, okay. Ooh, carpets, carpets. I live in Orlando, and if there's one thing, if my city could change, I would love for them to change the carpets in the Orlando airport, if anyone is familiar with those. All right, so furniture has now taken over. So this is some great, great information, and I want you all to continue thinking about this as we go through today's webinar. And now that we're all warmed up, I just want to introduce you all who may not be familiar with CityHealth about CityHealth. So we are an initiative of the De Beaumont Foundation and Kaiser Permanente. We work with cities to adopt a package of upstream prevention-oriented policy solutions that have the potential to improve health, well-being, and quality of life by addressing the social determinants of health. At CityHealth, we partner with the 75 largest cities, working with city leaders to adopt and improve policy solutions. At the end of each year, we assess policies in these 75 cities. In our package, we currently have 12, and award gold, silver, and bronze medals if policies meet our criteria. Even if you're not in one of our 75 cities, all of our policies have resources and tools that are available for free, which you can utilize to improve policy in your city. You can access all of these resources at cityhealth.org. Now, I mentioned we have 12 policies. This is the full 2.0 City Health policy package. As you can see, we have a wide range of policies designed to address key health domains, including housing, the environment, worker protections, tobacco control, and early childhood development. However, today we lean into our first joint webinar looking at our procurement policies of eco-friendly purchasing, also known as environmentally preferable products. So you'll hear that switch out between EFP and EPP, as well as healthy food purchasing. Eco-friendly purchasing is supported by our partner CEH, Center for Environmental Health, and healthy food purchasing is supported by our partner Center for Science and the Public Interest. We're spotlighting these policies today because they have the potential to expand access to healthier choices and ensure safer conditions for city workers. At City Health, we recognize the challenges that cities face right now regarding budgets and funding related to some of our other policies. However, procurement is a great opportunity for cities to use their huge purchasing power. The action that cities take in their purchasing decisions set a model for businesses and consumers citywide. We know that our cities are great examples and leaders, and we want to help all of our cities set the gold standard by adopting strong policies based on best practices informed by our national experts, CEH and CSPI. To start us off, we'll start with eco-friendly purchasing with Jose Aguayo, the Senior Manager at CEH, and Bella Garcia, Program Manager. Jose, Bella, take it away.
Thank you for that introduction, Cassandra. I will be covering what eco-friendly purchasing policies are and what benefits they bring to cities and other institutions that enact them, while my colleague Bella Garcia will touch on how cities can implement this policy package and meddle in eco-friendly purchasing policies, or EFP. So EFP policies outline product requirements and preferences that cities can adopt to procure safer, more sustainable, and non-toxic products. Ultimately, these policies make a statement, and a very powerful one at that, about the city's intention to safeguard people, the environment, and the entire planet. Next slide, please. The benefits of EFP are many. I will only do a brief overview, but feel free to connect with us later to learn more. To begin understanding these benefits, we need to start by realizing that 90% of our time is spent indoors. With this in mind, we also need to recognize that common products we interact with every day while we are indoors can contain harmful chemicals to health and the environment. For example, PFAS, or perfluoro and polyfluoroalkyl substances, are commonly used in furniture and carpet stain-resistant treatments. They are associated with things like reduced fertility and impaired fetal growth, as well as increased risks of certain forms of cancer and a reduced immune response. Flame retardants and antimicrobials as well can be used in furniture fabrics and have also been linked with things like chemical sensitization, endocrine disruption, and reproductive problems. PVC, or polyvinyl chloride, is extremely common in flooring, and this material is extremely harmful. Its production emits large amounts of greenhouse gases and uses several other toxic chemicals. Its transportation can lead to disasters like East Palestine, and its disposal through incineration, for example, releases even more harmful chemicals into the air, such as dioxins. VOCs, or volatile organic chemicals, can be off-gassed by adhesives that are used to assemble furniture and install flooring. And these can have various health effects, but some of the most egregious ones include damage to the liver, kidneys, and the central nervous system. Finally, quaternary ammonium compounds, or quats, are quite common in cleaners and disinfectants. And now these chemicals are strong respiratory sensitizers. They can cause asthma and are linked to other reproductive problems as well. Next slide, please. Now, in addition to the built environment products that I touched on, foodware and other disposable products we use every day can also affect our health and the environment. So more than 1 million tons of plastic is generated in the US, and 90% of it ends up in a landfill. Here, the toxic chemicals that these plastics have can leach out and affect human health. Styrene, for example, is released from polystyrene and can lead to certain forms of cancer. BPA is found in canned liners and certain paper products like receipts and can affect hormones and proper development in children. And also molded fiber products can release PFAS. Next slide, please. Now, to avoid the health and environmental problems posed by these chemicals, cities can really lead by example by choosing safer furniture, flooring, foodware, and cleaners. Now, many alternatives are available on the market that avoid these harmful chemicals, and CityHealth as well as CEH would be glad to help you identify these. Um, it is your purchasing power dictated by eco-friendly purchasing policies that provides incentives to manufacturers really to produce these safer alternatives and move the market as a whole towards better products. Next slide, please. Now with that, I will transition over to my colleague Bella Garcia, who will elaborate on how EFP metals are evaluated.
Great, thank you so much, Jose. And yeah, as Jose mentioned, within CityHealth, there are specific guidelines that we've created to help evaluate environmentally friendly purchasing policies, and help also give you a roadmap towards what can be improved upon your EFP policy towards an even more robust and more safe options. So here's the examples here. We have a three-tiered system going from bronze, silver to gold. Each tier has different requirements to meet under CityHealth criteria, and each one builds upon the previous level as well. So for example, to meet silver level requirements, you not only have to initially meet the bronze level requirements, but add some silver level requirements on top of that as well to fully qualify for that full silver medal criteria. Next slide, please. And so now we're going to be taking a dive into what the specifics of each of those levels are, with the first being the bronze level. So this is going to be your first step. With this first step, cities must have an eco-friendly purchasing policy, an EFP policy, or city ordinance that explicitly requires broad EFP practices and annual reporting of those practices. So with this, we say that these EFP practices must be wide in scope. So we listed a couple earlier, but these can include major areas of sustainability, such as toxics, carbon emissions, water usage, recyclability. There's a wide variety of different sustainability aspects that can be encompassed in this EFP policy, but overall, we suggest that these policies are a bit more broad or wide in scope. So for example, a policy that focuses on a single narrow area, such as only mentioning recyclability, will not qualify for this bronze level requirement. Another best practice that we recommend would be annual reporting, should include purchasing figures specific to product categories procured. This is just to help with data collection and just make sure that this policy is robust in meeting bronze level criteria of that annual reporting requirement. Next slide, please. All right, and then moving up from there, we have the silver level status. So again, a policy must first meet bronze level, and then on top of that, this product would need to meet specific performance requirements for one of the following product categories. So the three product categories are foodware, cleaners and disinfectants, and then furnishings. Furnishings encompass furniture, carpeting, and flooring. So again, you would only need to meet the requirements for one of the following product categories, but each product category has their own separate requirements that we will be discussing in the next couple of slides. So next slide, please. So this is a good example. So first things up would be foodware. So in this category, I've listed the specific requirements to meet the silver level for foodware, but then I've also included some policy language examples so that you can see specifically how these requirements look like in practice. So the first requirement within this example would be prohibiting EPS foam, so styrofoam and PFAS. And the example comes from City of District of Columbia. They say expanded polystyrene packaging and cups shall not be used. So again, very specifically within the foodware section of an EFP policy, they specifically mention styrofoam as being prohibited. And so that is the requirements we needed to meet that specific aspect of this policy. The next would be preferring of reusables. So this one comes from City of Minneapolis. This says that products that are durable, long-lasting, reusable, or refillable are preferred wherever feasible. So again, very explicitly calling out the preference for reusables in the EFP package is what we're going to be looking for when evaluating this policy. The next one would be use Biodegradable Products Institute, so the BPI certificate, or Compost Manufacturing Alliance, the CMA certificate, to define compostables. We particularly like the BPI certificate because by its definition, products that are BPI certified cannot contain PFAS. We've already stated that this is a chemical that we're looking to avoid purchasing, especially at a city level. And so the use of that certificate is really helpful in achieving that goal. Additionally, these certificates really help make the communication between purchaser and manufacturer easier to set specific standards for what we are looking for when purchasing. So this example here comes from City of Phoenix. So they very explicitly define compostable, especially around compostable plastics, which can sometimes be a little bit tricky to communicate. And then they specifically call out in this policy defining compostables under BPI compliance specifically. Next slide, please. The last requirements for the foodware section of the silver medal policy would be where reusables are not feasible, prioritize food serviceware that is recyclable or compostable in local facilities. And then this example below is from DC. I know we have some DC folks in the call here, so this is a very fantastic example of meeting this requirement. So not only does this first establish when to use reusables and when to use single-use foodware items with the language full service operations shall not use disposable or single-use utensils or servingware. An exception may be permitted for takeaway food, for dining areas that do not have a functioning dishwasher on site, or when reusable items may pose a safety hazard for the specific populations being served. So again, they specifically state when different food serviceware options will be provided. And then they also follow this up with the language, all disposable food serviceware designed for off-site use and disposals shall be recyclable or compostable. So then they follow that up with specifically prioritizing recyclable or compostable for these specific types of products. The last item would be the requirement for single-use accessories to be made available only upon request. So single-use accessories in this case are any of those smaller items accompanying a meal. So these are disposable napkins, those are utensils, straws, condiment packets, things like that. So these are still able to be provided by these cafeteria and food spaces, but only available upon request, so not just given freely out. Again, this example comes from DC that says disposable napkins, utensils, and straws shall be available upon request or from self-serve dispensers where applicable. Next slide, please. All right, so for the cleaners and disinfectants section, all cleaning and disinfecting products procured must meet one or more of the following certifications or performance requirements. So within these requirements, these would be Green Seal, Eco Logo, and US EPA's Safer Choice. As a note, our organization, Center for Environmental Health, has been following the status of Safer Choice. So we are happy to say that this requirement is still, even at a federal level, fairly secure. It is still at the same level it was when we first wrote some of these requirements. So we still feel that we can support and say that US EPA Safer Choice is an excellent certificate for these types of products. Another note is we would like to mention that it's a good best practice to list more than one of these certificates when writing your EFP policy, because this allows you a wider range of products available to meet these requirements. So for example, if you can't find a specific product under Green Seal or Eco Logo, there's other options available as well, so that you can find a wide variety of products to meet your needs. Next slide, please. All right, furnishings. So for this last product category, the requirements are that all furniture, carpet, or flooring procured must meet one or more of the following performance requirements. So for furniture specifically, we're going to be looking at the BIFMA requirements, the Green Health approved furnishings, or green screen certification for furniture and fabrics. Under carpet, we have the Green Health approved carpet standards. And then for flooring, we have Green Health approved resilient flooring, and then San Francisco approved. As a final note on that last one, San Francisco approved currently only has hard-backed carpet tiles and adhesives. So that product category is a little bit more limited, but there's the additional option to also have Green Health approved resilient flooring. This kind of goes back to what we were saying earlier, again, about the best practices to be including several performance requirements. Again, and then so this is so that you have plenty of product options available on the market to meet different needs that your city might have across the board. Next slide, please. And then finally, we'll be following it up with the gold medal status. So in order to meet a gold medal status, a city must first meet all the requirements of a silver EFP policy. And then on top of that, these policies must apply to all requests for proposals and contracts that cover the product category either directly or indirectly. So some best practices that we recommend when implementing this would be first things up, to be careful not to dilute this requirement by adding non-binding language, such as when feasible or when practical. We would only suggest that if these terms are properly defined first. And the example that we give is practical being defined as not exceeding 20% of the lowest bidding option. We like to give these definitions so that these policies can be more robust and more straightforward so people understand what these specific languages mean. We find that non-binding language can sometimes be a little bit difficult when working with these policies. So this language just helps make sure that it's communicated clearly on both the policy writer side and then on the purchasing side of things as well. Another one is that you should not include provisions that clash or oppose this requirement. So this example here says no provisions that require selecting the lowest bidding option. We understand that cities are definitely aware of cost, especially nowadays. And so our topic that we want to take away from this lowest bidding option is that oftentimes sustainable products might not have a fair shot on the market. So for example, reusable foodware products can be and typically are less expensive over the life cycle of a product, but these lowest bidding option language can sometimes not allow these products to properly compete on the market when compared from a life cycle analysis to a single-use product bought one time over and over and over again. We can see this is another example with cleaners. So sometimes there are concentrated cleaning products, which can be a little bit more expensive up front, but because they are concentrated, they can be used over a longer period of time. They require less packaging to ship out these products and overall are a more sustainable and more cost-effective option. But removing this language can sometimes help break that barrier between these more cost-effective but over a long-term options versus single-use options that must be purchased over and over and over again. Lastly, exceptions should be handled by a waiver process. We do believe that there can be exceptions, but in order for this policy to be robust, we think a best practice should be having a waiver process in place. So this specifically means that it is logged each time a purchase is made that doesn't comply with the policy, and then also documenting the reasons why the policy was not followed. And those are going to be the requirements for the gold medal. You can do next slide. Overall, thank you so much for listening to us. We're happy to connect and help you more with your eco-friendly purchasing policy. We have experience helping with the policy writing side of things, helping you pick specific product categories, working with you to figure out which section, which product category best fits your needs. So definitely feel free to reach out to us if you have any questions. And we can pass it back to the CityHealth team. Thank you so much.
Thank you so much, Bella and Jose, for that deep dive into eco-friendly purchasing. As Bella mentioned, they are available for technical assistance and policy. We'll talk about that later. But for now, we will jump on over to our healthy food purchasing policy from Jessie Silverman, campaign manager at Center for Science in the Public Interest.
Thank you so much, Cassandra. So we'll start with another Slido question. If you could answer the multiple choice question, is it easy to choose healthy foods and beverages on city property in your city? You put it in those responses. Okay, well, looks like we've got a good mix of yes or no. For those of you that said yes, that's great. And we'll talk a bit about how healthy food purchasing policies can ensure that it's easy to choose healthy foods and beverages on city property. So just to level set, although this may be familiar to some of you, poor diet is a top risk factor for chronic disease, including heart disease, diabetes, and many cancers, as well as premature death and disability. Consistent with all of that, the average American eats poorly relative to public health recommendations. This graph shows how the average American scores on the Healthy Eating Index, which is a score that assesses alignment of one's diet with the federal government's dietary guidelines for Americans. The maximum score is 100. So with our average score in the US hovering around the high 50s since 2005, we are not doing great. And researchers have modeled that if the average healthy eating index increased for the US population, it would improve health and save related healthcare costs. Next slide. So healthy food purchasing policies establish nutrition criteria for food purchased and served by government entities and facilities. Most people want it to be easier to eat healthfully. So rather than restricting choice, healthy food procurement policies aim to address a lack of healthy choices. Not only do these policies make the healthy choice the easy choice in public places, but they also leverage the substantial purchasing power of governments and institutions to shift the food supply toward healthier products that will then become more available to other institutions, retail, and restaurants. At the same time, healthy food purchasing can have a meaningful impact on people who depend on and regularly consume meals from public institutions and programs, such as government offices, parks and recreation centers, senior centers, after-school programs, correctional facilities, and shelters and transitional housing. Finally, healthy food purchasing enables governments to walk the walk when it comes to healthy eating, leading by example for the private sector. Next slide, please. Healthy food purchasing is an evidence-based policy lever. My organization, CSPI, recently conducted an extensive review of peer-reviewed research evaluating the effects of adopting nutrition criteria for food served in work sites and institutions. Evidence indicates that these interventions improve the availability of healthy options in work sites and institutions, positively influence consumers' food and beverage purchases and diet quality, and may improve long-term health outcomes such as body weight, risk of diabetes, and heart disease, as well as healthcare costs. Furthermore, we found that these policies can be financially neutral or even financially beneficial for the adopting institution. And while those conclusions came from a large body of evidence in public and private work sites and institutions in the US and other countries, on the next slide, I'll share some data from actual city-level policies. Next slide, please. So after implementing Boston's Healthy Beverage Executive Order, beverages for sale on city property were lower in average calorie and sugar content. Philadelphia's nutrition standards led to a reduction in sodium in city agency food offerings of 15 to 30%. Just looking at vending machine purchases after implementing nutrition standards, sales of healthier snacks increased more than threefold, and sales of healthy beverages increased as well. New York City agencies comply with 93% of the city's food standards, according to their most recent compliance assessment, indicating that the policy has been successful in creating a healthier food environment. Next slide, please. The World Health Organization encourages all governments, including country, state, and local, to adopt a healthy public food procurement and food service policies. They developed an accompanying action framework, which is a great resource for cities and other governments interested in this policy lever. It describes these benefits of such policies, including public health, economic benefits, increased productivity, boosting availability of healthy, affordable, culturally acceptable, as well as locally or sustainably produced food if you choose to prioritize those values, equity benefits because folks who depend on government services are more likely to be low income or socially disadvantaged, as well as large reach. Next slide, please. So the CDC is another authoritative champion. The term they use is food service guidelines, which the CDC says can make healthier foods more available, help people choose healthier foods, reduce energy use and food waste, again, if you use environmental criteria, reduce the risk of foodborne illness when you include food safety criteria, and support local economies when you include local procurement criteria. CDC also has a very useful implementation toolkit, which we'll share a link to later in the presentation. Next slide. So now I'll get into the CityHealth Healthy Food Purchasing Medal criteria. You can see that to earn a bronze medal, your policy must mandate nutrition standards for one or more city food service venues. And to earn a silver or gold medal, the policy must meet additional benchmarks in terms of the strength of the nutrition standards and the settings covered by the policy. Next slide, please. For the silver or gold level, nutrition standards must be at least as strong as the food service guidelines for federal facilities. These were developed by an interagency work group led by CDC in 2017 based on the Dietary Guidelines for Americans. Similar to what Bella shared earlier about the EPA certification, the food service guidelines remain intact, and we are monitoring closely to see if there are any modifications under the new administration, but for the time being, they remain an evidence-based standard for city governments. They were created for settings where food is sold, but can be adapted as needed for different settings. Policies can still earn a silver or gold if they develop their own nutrition standards, which we score on a rubric to evaluate alignment with key elements of the food service guidelines. So for example, does the policy address sodium? Does the policy specify what beverages can be offered? Does the policy require that whole grains be offered? I understand that it can seem fairly complicated, especially if you're not a nutrition expert. So I am more than happy to advise cities on the development of strong nutrition standards and how to navigate the medal criteria. Next slide. Another set of standards that a lot of localities are interested in is the Good Food Purchasing Program, which is a framework that helps governments leverage their food procurement dollars to advance 5 values: valued workforce, local economies, animal welfare, environmental sustainability, and nutrition. Cities can earn up to a silver medal if they adopt GFPP because the program's nutrition standards are similar to the food service guidelines. Next slide, please. Cities are also scored on how comprehensively the policy covers city facilities and programs that purchase, serve, or sell food. As I mentioned earlier, a bronze level policy applies to at least one venue where food is sold or served on city property or by a city agency or contractor. For example, some bronze policies apply to vending machines only. A silver level policy covers more settings. A silver level policy can apply to either all venues where food is sold on city property, such as vending machines, cafeterias, cafes, and concessions, or all venues where food is purchased with city funds and or served by city agencies or contractors, which would include meetings and events, feeding programs, correctional facilities, shelters, senior centers, child care centers, and public hospitals. A gold level policy covers all of the above, with some permissible exemptions, including contracts made before the policy's effective date, as well as venues on property owned but not controlled by the city, such as arenas or airports that are leased to another entity. Next slide, please. I wanted to share an example of a gold medal healthy food purchasing policy, and we created a written case study about Philadelphia that you can find on the CityHealth website, but I'll summarize it here. So in 2014, Philadelphia's mayor at the time issued an executive order establishing the city nutrition standards and their scope and mandate. The city's Department of Public Health then led the creation of a separate administrative document specifying the nutrition standards and adaptations for different settings. The nutrition standards are explicitly based on the food service guidelines for federal facilities, and they apply to all agencies that purchase, serve, sell, or otherwise provide food, including contracted vendors. Initially, there was a limited choice of products on the market that met the standards, particularly for sodium. So the city partnered with a lab at Drexel University to develop new products that could meet the standards, including a whole grain hoagie roll that met sodium limits. And that roll, as well as other products developed through that partnership, went on to be used throughout city facilities and programs. So as I mentioned, you can read the complete case study on the CityHealth website. Next slide, please. So I'll wrap up with some key considerations and best practices for healthy food purchasing policy development and implementation. First, the mechanism of policy adoption. Healthy food purchasing is a policy that can be adopted through multiple mechanisms, including an ordinance, executive order, administrative regulation, or even through a contract with a vendor. Many jurisdictions have used the executive order mechanism because it's easier politically to enact, but an ordinance is preferable if you can manage it because it's harder to change, but either would be eligible for a medal. Then we recommend designating a coordinating agency because it's important to have one agency. Typically, it's the health department, or it could be the Office of Food Policy if you have one, to be responsible for coordinating the implementation and evaluation of your healthy food purchasing policy. If no one is responsible, it's much less likely to get implemented. And then it's a best practice to adapt existing evidence-based nutrition standards and tailor them to your city's food service context. So that's one reason why we recommend the food service guidelines for federal facilities as a model, and they would need to be adapted for certain settings. You can also start with another city's nutrition standards, like you can look at Philadelphia's, and adapt them for your city's context instead of starting from scratch. We also recommend planning for technical assistance to support agencies with implementation. It's likely that agency procurement and food service staff will need technical assistance to apply nutrition standards. For example, the coordinating agency might provide regular trainings and refreshers on your nutrition standards, review menus and recipes and recommend modifications, provide acceptable product lists, and assist with contract language to hold vendors accountable. We also recommend planning to educate and acclimate customers because food service operators may be concerned about losing revenue or customer satisfaction if they have to substitute healthier items for popular but less healthy items. To prevent this, it helps to get customer feedback on potential new menu items through taste tests, educate customers about why there are some new healthier choices with signage, and phase in implementation so it's more gradual. It's important to be mindful of contracts with third-party food service providers, and this is sort of baked into the CityHealth medal criteria. But just to reiterate, it's critical to integrate your policy, your nutrition standards, into any new or renewed contracts with food service vendors once the policy is adopted. Without doing this, it's difficult to hold the vendor accountable for implementing the policy. And then finally, monitoring and evaluation. It's very helpful to establish a monitoring and evaluation plan for the coordinating agency up front so you can track whether the policy is being implemented to celebrate success and troubleshoot if needed. If you have additional resources or partnerships, it's ideal to evaluate the impact of the policy on outcomes like sales of healthier food and consumer diet quality. Next slide, please. So here are some key resources to get you started with policy development and implementation. We'll make these slides available after the webinar so you can access these links. And I do encourage you to get started by getting in touch with me for tailored technical assistance. Be happy to work with any of you. So now we're going to have a few more Slido questions before we move into the Q&A. After hearing this presentation, what other information would you need to recommend this policy to a decision maker? And you can answer that as a city employee or as an advocate, whatever applies to you. Someone answered economic benefit. Very good point. We have a few more people typing. Okay, someone said we have made the pitch, but policymakers have not adopted a policy. I'd be curious to know more about that. Documented health outcomes before and after policy. Yep. Compelling data on dollars spent upfront compared to long-term benefits. Okay, I think we could move on to the next one, and if we have time, we'll address some of those in the Q&A. So the next question is, what are the biggest barriers to adopting this policy in your city? And this is a ranking question, so you can rank these in order of importance to your city. The inability to prioritize over other urgent matters is winning, followed by perception that healthier food costs more. Oh, just kidding. Followed by lack of staff time to oversee implementation compliance, then perception that healthier food costs more, then resistance from vendors, resistance from city agencies, lack of technical knowledge about nutrition and procurement. I'm not seeing any votes for perception that, or I guess perception healthier food is less appealing. It's the lowest option. It's the lowest ranked so far, which I appreciate as a dietitian. Thank you for participating. I'll turn it back over to you, Cassandra.
Thank you so much, Jesse. And I want to thank our audience for participating in our Slido questions, but I also want to welcome you to put any questions that you may have in the chat. Today, as we went over our eco-friendly purchasing policy and our healthy food procurement policy, we really wanted to take a dive into policies that can be passed via executive order and that get at what you all were mentioning and kind of getting to around looking at cost benefits of such. These policies are really great ways to leverage that city purchasing power to make healthier choices, to make more environmentally friendly and sustainable choices, and really for cities to set the example for private sectors and industries as usually one of the largest entities who are purchasing things across the city. And so I really welcome any questions that you may have. So I'll give a couple minutes for some questions to populate. But I also want to further highlight the fact that both CEH and CSPI, as they have mentioned, they do provide technical assistance. That does look like providing model policy legislation for you to review, as Bella went through in her slides. As Jesse mentioned, as you are developing policy, you can reach out to CSPI or CEH through CityHealth or through the contacts as we get to them later for advisement on, is this policy going to meet bronze, silver, or gold level with CityHealth? Because you're doing some really great work and we want to be able to recognize that. But we also can further help with the ways that Jesse mentioned in terms of monitoring, evaluation, and guidance to make sure that you are not only passing a robust and strong policy, but one that really does get to that health impact, which we've learned in the research that we've developed. There's also really great resources on cityhealth.org, which feature from both of our partners here today, CEH and CSPI. And so if you need either of those, I do welcome that. This is a question for both of you. Something that we have gotten a lot at CityHealth is, what is the cost benefit? How do we know that people purchasing these products or this healthier food is either cheaper or the benefits actually outweigh the cost? Can either of you speak to that from both of your positions of the policy? Bella and Jose, I'll pass it to you first since Jessie just wrapped up her portion of the presentation.
Sure. I can answer from my side, especially around with foodware, and then I can pass to Jose. But as we've seen, first and foremost, when more people are purchasing very specifically non-toxic or more sustainable options, this does put pressure on the market. Even in my personal experience, I've seen costs go down for products that are traditionally labeled more sustainable as people are requesting this of manufacturers. So higher demand equals lower prices, and cities can help play their role in applying these market pressures. Additionally, that's on a more broad scale, but just on a more day-to-day scale with reusable foodware, there are studies that show that it is more cost effective to have reusables over single-use foodware items. And so these policies are really taking aim at that and trying to prioritize reusables and make sure that reusables are at the forefront with foodware purchasing. And that can definitely have an environmental and cost-effective benefit for cities. And then with that, I can pass to Jose.
Yeah, I think Bella touched on, the life cycle analysis of the cost of these products, right? Not necessarily just considering the upfront cost. Um, for the built environment section of our presentation, furniture, flooring, and healthy cleaners. It's about sort of analyzing the trends in the market, I think. And for that, furniture, for example, I think it's the prime example that we can point to where the evolution of the pricing and the availability of safer alternatives over the past 10, 15 years has trended towards much higher availability and much cost comparable prices. To the point where CH, for example, now we have a database of furniture products that meet all the standards that we presented on, and that currently contains nearly 3,000 products that are available for large purchasers like cities. And so we have tracked this evolution over time, again, from 10, 15 years ago, where only, a couple hundred products were available, where now, that number has, quadrupled, if not more. And the pricing has virtually equaled, right? Other product categories are following similar trends, may not necessarily be there just yet, but I think, it's encouraging to see that, like Bella was pointing out, this is all because of purchaser demand, right? Manufacturers saw this and they adjusted their product chemistry and their pricing as well to meet that demand.
Great, thank you.
For healthy food purchasing, we don't have data like that actually follows city policies, or even city policies that have been enacted and actually like collects data for a long enough period of time to be able to see what the health outcomes are or the healthcare cost changes. It's very difficult to actually do that kind of study. So what we have are studies that can look at very short-term health effects, and also studies that project what they anticipate the healthcare cost savings would be if these policies were in place for a long time. So for example, some researchers at Tufts and Harvard did a modeling study a couple of years ago that that modeled the long-term health benefits and healthcare cost savings if the food service guidelines for federal facilities, so the model that is used in CityHealth's metal criteria, were implemented in government cafeterias, and they assumed that government employees would be eating in those cafeterias only twice a week. So, and even that, they found that there would be a long-term benefit in terms of reduced cases of diabetes, reduced deaths from heart disease, and long-term cost savings, healthcare cost savings. So it is relatively modest because people would only be eating those meals twice a week, but at a population level, it can, add up. And also, if you're thinking about people who rely on institutional food more than twice a week, like people who are incarcerated, people who might be relying on food assistance programs, we would expect the savings to be larger. Also, another thing that we see in the research is that implementing these policies does not have to cost anything necessarily, or it can cost very little, or it can actually lead to revenue increases. So if you're concerned about, whether there will be a cost benefit, it actually might not cost you much or cost you anything to implement the policy. So there's much less risk there. So I want to share this literature review that I recently published with some colleagues. I'll put it in the chat, that identified all the studies on this intervention in a variety of different settings, and that looked at outcomes of improving the food environment, improving diet quality, improving health, and the financial implications. So it doesn't really synthesize those findings. It just lists out all the studies, and you can explore the findings for yourself, but you can see all the studies that we found that looked at the health effects. You can see the studies that we found that looked at the healthcare cost savings. And again, I'd be happy to help you, sort through those findings and translate them however it be most helpful for your policy development.
Thank you both for Jose.
Yeah, I just wanted to add one more thing that I think it's important also to note that just as the EFP policy as well as Jesse's healthy food policy account for health um, in the place of use, we should also look at downstream effects, right? So, for example, the effects of products that contain some of the toxic chemicals that we mentioned when they are being disposed of, right? Not necessarily the users are being exposed, but communities, oftentimes environmental justice communities, that are affected in the downstream effects of these of the disposal of these products, right? So that's another area to kind of incorporate into these assessments of cost that oftentimes are overlooked.
Thank you so much for uplifting that, Jose. And I think it's so important that we do, because so much of the policies that we enact and the actions that we engage in, sometimes we don't think of the after effects and those downstream effects. And while policy is a great upstream way to address health, having that knowledge of downstream effects that we've had lots of examples of can help us inform why these upstream policy changes are so important. I also want to acknowledge just that #1 ranking of the inability to prioritize over other urgent matters. Now, we know cities are facing a ton of different things. There's a lot going on. That's why we have a 12 policy package full of items. However, both of these policies, while that question was just in regards to healthy food purchasing, both of these policies are really great opportunities to find a win in your city if you would like to, for that recognition of a really strong policy that is moving that forward. I also want to uplift these policies have been part of our 2.0 package for 4 going on 5 years. And while there might be an inability to prioritize it due to urgent matters, just can we get one thing from you, Jesse, and one thing from you, Bella or Jose, about what is one thing that cities can be doing to prepare a policy like this, so that way when it is prioritized, people are ready to get it passed and get it ready to go? What would you recommend?
I can start. I would say the most important thing that you can be doing is a landscape assessment of food procurement and food service activities in your city, like finding out how each agency is or is not purchasing and serving food, because it'll be important to tailor a policy to reality.
Thank you.
I think for our end, I mean, I can't stress this enough, that connecting with partners like CityHealth, like CEH, like CSPI, in preparation for development of a policy is what I would recommend the most. We have the resources in terms of the product categories that you'd be looking at, and the model language that could be used for a policy, an implemented policy, right? So connecting with us, even if you're not ready to do so right now, I think would be my suggestion.
Thank you both so much. If we could just put our presenters back on the screen again. Thank you, Jesse. Thank you, Bella. Thank you, Jose, for you all sharing your expertise this afternoon. It has been so helpful, and I hope it's a great guidance to our participants as they are either crafting their HFP or EFP policies, as they are trying to sway decision makers in their cities to adopt these policies. So I want to thank you all so very much. If we could go back to our slides quickly, and I just want to invite everyone once again to please visit cityhealth.org. There are tons of resources there that our phenomenal partners have developed that we encourage you to use as you are crafting and developing and thinking about these policies in your city. In addition to that, earlier this month, CityHealth did release our Green Space Policy Action Guide. This really showcased the new work happening in Fort Worth, Texas, and expanding green space for its well-being on all residents. That's our newest and most active resource that's available. So please, once again, check out cityhealth.org. And of course, more than anything, we really encourage you to please stay connected with CityHealth. You will be the first to know when we release our 2025 medals. The deadline for us accepting any policies, including EFP and HFP, in your city, if passed by executive order, is November 10th. So if you want to kind of slide something in, please do reach out to CityHealth, reach out to CEH or CSPI. We would be glad to help you. So December 9th, our 2025 policy assessment will be released. And please do stay tuned to CityHealth, CEH, and CSPI by following us on social media on all major platforms. Please sign up for the CityHealth newsletter. CEH and CSPI also have really great newsletters I encourage you to sign up for. And if you're from a city and you have some earned media resources, please let us know. We want to share your city's successes. Everyone who is attending today will receive a copy of these slides. And once again, thank you so much, Jose, Bella, and Jesse, for the wealth of information you've provided, not only today, but as subject matter experts and partners to CityHealth. We truly appreciate the work that you've continued to do to help cities and us continue to spread really upstream well-being promotion policies. So please connect with us at the emails listed here on this screen. Thank you all for joining us and have a great day.